Have you ever been frustrated to see some deficiency in the healthcare system at your hospital? Have you ever thought of making some improvement in the healthcare system that would benefit the patients? Well, there are two ways to do that. The first one is called a clinical audit, and the second one is called Quality Improvement Project, QIP. In clinical audit, you have to compare your observations against standard set of guidelines of medical practices, while in QIP, the intention is simply to improve the currently undergoing practices without comparing it. Now, how do you proceed with these? The first step is to identify a problem which you think needs improvement. For example, you observe that in patients of sepsis and septic shock presenting at your emergency department, there is a significant time delay in administering the first dose of antibiotic. So, the title of your project will be Time Delay in Administration of First Dose of Antibiotics to Patients with Sepsis and Septic Shock Presenting to Emergency Department of XYZ Hospital. So now you have done the step one, that is, identifying the problematic area that needs improvement. Next is step two, which is getting your project title approved by your clinical supervisor or head of department. Then, proceed to the third step. Now, start collecting the data and observe silently as to precisely how much time delay is happening in minutes or hours from the point of patient's first contact with the hospital to the administration of first dose of antibiotic. During this third step of silent observation, the medical team responsible should be unaware of your data collection so as to get the actual results. Let's say, among the 30 patients you observed, 25 received first dose of antibiotic after 3-4 hours delay, and only 5 patients received administration within initial 2-3 hours. Now proceed to the fourth step. In this stage, you will make a plan as to how to improve this deficiency in the healthcare system and identify the factors which are causing the delay in administration of initial dosage of antibiotics. You will organize mini seminars, lectures, poster presentation, leaflets distribution, or whatever suits you in your area of medical practice, which in your case will be the emergency department, ED, of XYZ Hospital. You will share with your colleagues the need for shortening the time delay and discuss with them how to fasten the administration of first dose of antibiotics to patients with sepsis or septic shock. Now, focus fully on the next few slides. If you are doing the clinical audit, your goal will be to maximize the percentage of patients who are receiving the first dosage of antibiotic within the first hour, which is the target set by medical guidelines in patients of sepsis or septic shock. On the other hand, if it were a quality improvement project, QIP, your sole goal will be to decrease the time delay of administration of antibiotics as compared to your initial observations in the step 3. Now proceed to step 5 after a gap of 2 months. In this step, you will again start collecting data and observe once again the time delay in the administration of first dose of antibiotics. Compare the results of this step 5 phase of data collection with the initial results of step 3 phase. Check and document that how much of an improvement have you been able to make by shortening the delay in the administration of first dosage of antibiotic to patients with sepsis or septic shock. And this is how, my friends, you do a clinical audit or a quality improvement project, QIP. To summarize, just follow the PDSA cycle of planning, doing, studying, and action. Subscribe my YouTube channel for more medicine-related content.